Hi, I'm Dr. Brad Shook, and I'd like to welcome you to this presentation. Today, what I want to talk with you about is new technology in spine care, and in particular, we want to look at the treatment for a number of different spine conditions, and I've got them listed here on the screen, several that apply, and there are actually a few more, because we're going to talk about new technology that is non-surgical and non-drug. So let's talk about the common medical management for these different spine conditions. Now, in a typical medical model and in what we see in our practice is that the first line of defense is either physical medicine or resting, ice, elevation, and then compression, or some anti-inflammatories typically over the counter. If those don't tend to work for people, then they tend to present to our office where we will either perform physical medicine procedures, either chiropractic or physical therapies, and then it can be at the same time, we can do a trial of those therapies or refer them for further pain management, which can be to the primary care physician for muscle relaxers or more powerful anti-inflammatories. Sometimes steroids are recommended, but that is typically after a failed trial of conservative physical medicine, such as chiropractic or physical therapy. Now, if the patient, or if you're with your problems, if those interventions, the chiropractic or physical therapy, in addition to those anti-inflammatories, muscle relaxers, if that is not getting results at 4 to 6 weeks, or if you're progressively getting worse, then what's typically done is an imaging study is ordered, like an MRI. And at the same time, we will often prepare to set you up an appointment with a pain management physician or a surgical consultation. It all depends on the individual and what your examination findings are. But if let's say that the physical medicine, the chiropractic or physical therapy, and the primary care physician's pain management recommendations aren't working for you, and it's not improving, or you're getting worse, then we'll get the imaging study done, and we'll refer you to pain management. If it's a very severe spinal problem, then you're referred directly to a surgeon. If not, then you're typically referred to pain management, where they can perform steroid injections and other pain management interventions. And a lot of times we will co-manage you with that pain management physician. So you'll still receive physical medicine and pain management at the same time to try and avoid surgery, because it takes a team effort a lot of times to help with these conditions. Now, as far as pain management goes, all of these medications have very significant side effects. So we don't want to use them unless we have to. And with steroid injections, that's one of the things that can cause you to have longer term issues with the integrity of your joint, muscle, and bone, because the steroids are anti-inflammatory, but they also demineralize the bone and they weaken the surrounding connective tissue. So you don't want to use very many of those. And if you're diabetic, they will raise your blood sugar, because cortisone, which is typically used, will raise blood sugar. So they have a number of different side effects. And then if that doesn't work, then you're typically referred for surgeries, which are very invasive, and we can't go back once we perform those. And then if all of these interventions, you don't get the results and you're still having pain, then the last resort is a spinal cord stimulator, which is actually something they implant into the spine to help with pain. And those can be good, they can be bad. You just don't really want to get there if there's any way possible to avoid it. But that's the typical medical management of these problems. And the main thing to know here is you don't want to skip a step. If you jump into, if you go into a more invasive therapy first, you can't go back all the time. Like, for example, if you have surgery before you have a lot of these other interventions, you can't go back and perform those other treatments, because once you've had surgery, it's permanent. It's done, and a lot of times it's very limited on what we can do. Sometimes we can use some new therapies that we have, like in our office, like laser therapy, but really your best chance is to not get to that point, if you can help it. Sometimes surgery is the only option, and we realize that, and we do the best that we can for people. So this is the common medical management, and something I just wanted to kind of go through, because the main thing is you want to start from least invasive and then go progressively to more invasive therapies if you have to do that. The benefit of the less invasive therapies is that they're less risky and they cost less. The further you go, the more expense that you get, and then the more risk there is with the procedure. Okay, so let's get to it then with these common conditions. So what I want you to see here, and we're not going to spend a lot of time on this, but I just want you to look at the spine over here. At each level of the spine, they're illustrating different types of disc conditions. And at the top, you have a normal disc, which is nice and even. It has normal disc height. The bone has a nice, even, smooth shape to it. This is what we want to see in a normal spine. Here is a degenerative disc. It's where the disc begins to lose water content, and it can have tears. Typically, these discs are not as thick, so they're starting to thin or degenerate. At this level, you have a bulging disc. Now, bulging disc is kind of like when the disc mushrooms out. If you think of like a ball of Play-Doh and you press down on it and it just kind of spreads out, that's a bulging disc. And what happens with these discs is that the disc can cause pain, but it can also compress the nerve that exits the spine behind the disc, and that can cause the pinched nerve and result in sciatica and nerve problems. Here at this level is a herniated disc, and a herniated disc is where the disc, the jelly-like material inside the disc has a tough cartilage wall, and inside it has a jelly-like material. In a herniated disc, that jelly-like material squirts out, okay? And there are different types that we can describe them differently. Herniated, we can call it an extruded disc, and so there's a lot of different ways we can classify them, but the basic idea is that material comes out, and that's a herniation. Then here at this level, there's a thinning disc, and this is a degenerative disc. Typically, this starts with a degenerative process like we saw on the disc here at the second level, where it starts to tear and it thins down, it starts to lose water content, and with time it becomes a lot thinner. And that can cause you to the space where the nerve exits the spine to get smaller, and you can have compressed nerves from it. And then at these two levels, these are degenerative disc conditions, at both levels, with osteophyte formation. And these are osteophytes are where the bones start to change shape and spur, and this is from wear and tear, and this is something that you'll often see together are osteophytes or these bone spurs in combination with degenerative discs. Now, these conditions are all something that we can treat. It depends on the individual. Some disc herniations we can't treat. With all of these conditions, we have to consider the individual. But what I want to do is talk about what these have in common. All of these conditions are compressive disorders of the spine. So due to weight bearing and loading, it tends to wear the spine down. You can have traumas that induce herniations, and herniations are actually traumatic. Even if it's just from a slow bend forward, picking up the paper, that's still considered a mechanical trauma. But they're made worse with compression or standing in most cases. Sometimes standing gives you relief, but that tends to be because you're moving in a way that takes pressure off the nerve when you stand. So these are compressive disorders of the spine, and that's what they all have in common. And they also have in common that there is damaged tissue that needs to heal. So at all of these different levels here, there's inflamed and damaged tissue that we need. If we can do it, we need to help those tissues to heal faster. Okay? Now, decompressing the spine, if all these disorders have one thing in common, that they're compressive and there's tissue inflammation, then one of our goals with treatment should be to decompress the spine. And this can occur in two ways. It can either be done surgically or it can be done non-surgically. And surgically is the last resort. It's sometimes, there's no other option, but surgical decompression, which we see here, is the last resort. And with surgeries, there's obviously, it's very invasive. We have to open up the spine, and there are numerous procedures, but it's very risky, very dangerous, and something we want to do at a very last resort. And then there's non-surgical decompression therapy, which on this picture, this is actually someone that's having a gentle, non-surgical decompressive therapy performed of their lower back. We can also do it with the neck, which in this picture you can see here that this lady's having her neck decompressed, and we can treat spinal conditions of the neck or the cervical spine as well. So these are the ways that we want to approach it if we can. They're the least invasive, and if these work, then this is what we want to do from a safety and a cost perspective. So non-surgical decompression works because it gently pulls and separates the bones of the spine, and what that does is it takes pressure off the nerve, the joint, and the disc. And that's important because all those are generating pain. But the disc itself, when you take pressure and you unload it, you will actually can create a vacuum or a pull of water and nutrients into the disc. And that can help the disc to heal. So we can accelerate the tissue healing, and that will, that's what we want to do. We want to unload the spine, take pressure off all of the joints, nerves, and structures that could be causing pain, and we want to accelerate the healing process if we can do that. And that's how decompression therapy works. Now, I want you to hear just a few of the stories of some of our patients, and then I want to talk about a few of the other therapies that we have that are cutting edge. And we're not going to listen to the entire video here, but I just want you to hear a few of the stories that some of our patients have had with decompression, because they're really, truly amazing, and I just want you to hear from them firsthand.
Hi, my name is Kim Alice, and I'm coming to Dr. Shook because I've had chronic back pain for as long as I could remember, and my husband had a friend at work who tried decompression therapy, and he had great results with it. So I came to see Dr. Shook because that service is offered here, and I tried it for my back pain after I was diagnosed with a condition called DISH, which is a chronic arthritis condition, and I also had complete numbness in my left arm and wanted to find out if decompression therapy would help with that. And so I've tried it, and it's very safe, it's very comfortable, it's easy to do, and the treatments take just a few minutes each time, and I can honestly say it has helped tremendously with my pain, and the numbness in my arm is completely gone away. So I would highly recommend decompression therapy here with Dr. Shook. I drive almost 40 minutes for my treatments, and it's worth every second I'm in the car. So don't stop. Come on in and try it today. You'll be glad you did.
Hi, I'm Christian.
So I'm not going to let it continue going. You can go to our website and watch the numerous testimonials. We probably have 15 to 20 on decompression therapy alone. There are videos, and these people had great results with our treatment, and that's because we examined them, looked at them, made sure they were good candidates for decompression, and then we treated them. And we use the latest technology to help people get better. So I just want to share that with you because we get a lot of questions, and people wonder if it can work or not. And so I'd like to show the experience of a number of our patients, and then I would also like to share with you some of the research. And I'm going to just go through a few research papers very quickly. And in this paper that was in the Journal of Neuro Research in 2001, they said that we thus submit that decompression therapy should be considered first before the patient undergoes a surgical procedure which permanently alters the anatomy and function of the affected lumbar spine segment. And this is important because they're telling you should consider, just as I laid out the medical management, how it should be approached, least invasive to most invasive, because once you have surgery, it permanently alters the anatomy and function of the affected spinal area. Okay, so we don't want to do that if we don't have to. Another paper in Clinical Care in 2004, they stated that spinal decompression showed that 86% of 219 patients who completed the therapy, so 219 people went through this study, reported immediate resolution of symptoms, while 84% remained pain-free 90 days post-treatment. That's really important because longer term, a lot of people still maintain benefit. Now, a lot of times with these conditions, they're degenerative by nature, so that means that they get worse with time. So if we can help you to get your function and pain back and down, you need to maintain your condition. And that means that you do certain things at home that we will share with you, that you lose extra weight if you have extra weight, and that you get your physical activity up. And that oftentimes requires that you come in occasionally and get maintenance treatments to help with the spine. And there are numerous other studies. There are 3 more here where they talked about in the Journal of Neurological Research that decompression was successful in 71% of the 778 cases. The American Journal of Pain Management, they said good to excellent relief in 86% of patients with herniated discs with back pain and sciatica symptoms being relieved. And that is outstanding. This is more consistent with what we see. 3 out of every 4 people tend to have pretty good results with the treatment. That doesn't mean you have no pain, but that means you're significantly improved. But there's 1 out of 4 that doesn't respond. And those are cases that we do our best to qualify, but you have to give it a trial of treatment. You have to go through the protocol to properly assess if it's going to benefit you. So can anything else be done to speed the healing? And we get this question a lot, and I am constantly searching for ways that we can improve our outcomes and help people to get better faster. So in addition to decompression therapy, things that I have added to the clinic are laser therapy. And I'm going to talk more about laser because it is truly going to revolutionize musculoskeletal care, so back pain and treating a lot of muscle, joint, and nerve injuries. And then we also recommend cutting-edge science-based dietary changes for healing and weight loss. A lot of people that have back conditions and degenerative spine conditions have problems with weight, and we have to address that. And it has to be addressed because we talked about all of these problems having one thing in common, and that is compression. And weight adds to the compression of your spine. So we can help you with that. And then also I recommend new supplements for healing. And I'm not talking about joint formulas or MSM, glucosamine, or chondroitin. Those are old, outdated supplements. There's new science, new technology for healing cartilage. And that's what we want to focus on, and decreasing inflammation, increasing blood flow. And then also we have something called the ATM2, which is Active Therapeutic Movements 2. It is a piece of equipment that can help people with if they're having pain with movement, so pain with bending, their low back, neck, sometimes hip, and sometimes shoulder. The ATM2 is, I'm going to show you some videos on it because you have to see it. It improves muscle coordination. So it just gets the muscles working together normally again. People that have back pain tend to guard and have, they can't move as well. They're real tight and their body's naturally guarding movement. The ATM2 helps to correct those problems, and you can move with less pain, and a lot of times it works 50% or greater in one time. It depends on the condition. If you have a bad disc herniation, it's not going to help that much. But if you're having more of a muscle problem, the ATM2 works great. So let's look at those. Laser therapy, I'm going to go through some of the benefits of laser. In the last 3 years, there have been 1,000 research papers published per year. That is an incredible amount of research being done in laser. And we know that laser has so many different benefits depending on the way that you use the laser and that you set the laser, the wavelength and the time and the power settings. We have 3 different lasers in our clinic. We just added one that is the current state-of-the-art laser. There's not one better on the market today. And with laser, we know that it decreases pain. It accelerates the healing of tissues. Now, can you see how accelerating the healing of tissues, in particular cartilage, which is what the disc is primarily composed of, would be very important. So we can do decompression in combination with laser therapy and help accelerate your healing. We can also use it to help decrease inflammation, help form new capillaries so you get better blood flow to the disc. And we can use it to stimulate new collagen formation, which is the connective tissue. And you can see there are a number of other great benefits to laser, and these are just a few. So I want to let you know that we use laser therapy. I want to show you the laser that we use in our clinic. This is one of the lasers that we use. This is the MR4. It is a super pulsed laser. It is absolutely amazing. It's very high powered, but because it pulses, we can use it for longer and get better results. Here's a picture of the MR4. I'm just using it on my hand to show you how it lights up the area with light energy, which helps to do all of those things we just mentioned: accelerate healing, speed up circulation and collagen formation, helps with nerve healing. And then this is a picture of the pads that we use in our clinic. And these are lasers as well. They're embedded into a pad, and they're alternating rows of laser and then infrared. Infrared is a form of heat, but these infrared waves, the LEDs that we have, you'll see the ones that look kind of dark. Those are the infrared. It's not a visible wavelength of light, so you can't see it. But what they do is they deep heat the tissues, and is absolutely, when we use these things in combination, we can really have good success and a very good opportunity to help people get better and live a better quality of life, improve your function. I want to show you just a few videos of using the ATM2 because you've got to see this stuff to believe it, to understand how it works. Now remember, this improves the muscle coordination so you have less pain with movement.
All right, so this is Judy, and when she tries to bend forward, which you can try now, it hurts at what point? Right there? So that's not very far. And you said it's like a 5 on a 10 scale right now? Okay, so we're going to use this thing called the ATM2, and Christy's going to take care of that for us, and you can go ahead and stand straight up, and I'll be back to see what your results are in just a few moments. Okay, we just completed the ATM2 treatment now. See if you can bend forward without pain. Well, look at you.
Oh my God.
So what What do you think of that?
That's wonderful. You did it again.
So there you go. So another success with the ATM too. Thank you very much. So this is Dean. He's having some back pain today, and show us how far you can bend forward without hurting.
Starting now. Now it's bad.
So now it's bad. Okay.
That's real bad.
All right. So now we're going to use the ATM 2 on you, and then we're going to see what happens. Okay.
Okay.
All right. So now the active therapeutic movements are being applied while he's strapped into the ATM 2.
Is that okay? You're not feeling any pain?
No.
Okay, good. And again. And back to neutral.
All right. Go ahead.
So now I want you to go ahead and do the same motion that you did before the bending over and see how far you can go when you have pain. Any pain? No pain at all.
So what do you think of that? I told you, it's like magic.
I know.
It's freaky how it works.
Cool, huh?
Yeah, I mean, where to go?
It's gone.
It's gone. It just retrained your muscles.
I can go dance.
It's good to go.
Ever since I had that, well, I don't know what you call it, but that machine.
The ATM 2 he's referring to.
Oh, okay. That was like, that was a miracle. I had trouble walking up steps with my leg. That went away. My back was in such bad shape, I couldn't hardly do anything. I mean, I couldn't even work in the garden or anything. And ever since I've had it done, everything is actually better than it's been for a long time. My leg, no problem with my leg. My back, if I go 2 weeks before I get adjustment, I'm really hurting. And I've never been this good after 2 weeks. So.
Good.
Okay, so I'm not going to continue with that. You get the point. I mean, the ATM2 can be a phenomenal piece of equipment, and I don't want to spend our whole time watching these videos, but I want you to see how it works and some of the results that we can get with these treatments. So can you see how if we combine this together, we can get much better results than just decompression, just laser therapy, just active therapeutic movements too? And you may or may not be a candidate for all of those things, but when we do these things in combination, we get much better results than even what the research shows us. So which treatments would you need? You know, it just depends on what's causing your condition. Everybody's different, and different causes require us to take a different approach. So depending on what's going on with you, that's the reason that we need to do an evaluation and take your history and figure out how it started, do an examination, and then take x-rays if needed, and maybe even order additional imaging like an MRI to properly diagnose and work up your condition. So we can tell you if we could might be able to help you here, or if you need to be referred somewhere else. This is something that everyone knows that's had back pain, and I see it every single day, that it can be very debilitating. It can stop you from participating in social and family activities. It can make your personal care, cleaning up around your house, just bathing and the personal hygiene very, very hard to do, if not impossible. And then if you're working, it can completely take you out of work. So it is something that it is a major problem for our modern society, and it is something that I've made my mission to try and help people with as effectively as possible. And this is something I want you to know. I mean, these are problems that don't delay in getting this looked at. If you're watching this video, give us a call, because I would be happy to take a look at you and give you my opinion. And at least you'll have more information. And this is something I work up every single day. Keep this in mind. These problems are progressive. So once you have a back problem, if you don't treat it, and even if you do, it's going to progressively degenerate, because these are degenerative by nature. So what we can do is, if we can identify it, maybe we can stop the process, maybe we can slow it, because that's the faster it accelerates, the less of a candidate you are for what we do, and the more that you're going to have to look at those more invasive procedures to potentially help you. And those don't fix anything. I mean, even surgery doesn't fix it. When you have fusion surgeries and they bolt it apart, you're looking at 10 years, and then you have to have it redone. And that's because it basically fuses two bones together, and the bones above and below the spine have to move more. So, and that's best case scenario. These are things that, just keep this in mind, and I want you to know that we're here to help you. It's my goal to help you get your life back, and if you don't know what's causing it, then let's find out what's causing your pain and see if we can help you out. And we do that, we want to work out and figure out what's your problem. And then once we know what your problem is, and we have a good diagnosis, then let's see how we can help you, whether that's here or somewhere else. And if we can use any of our cutting edge therapies, then we're excited to see if we can help you get your life back on track and get you back doing things that you enjoy.